Hi, I'm Carlo Cerdasco, National Field Director for the Nationwide Retirement Institute. Today, I'm going to share a story that a financial professional shared with me about simplifying and breaking down planning for healthcare and Social Security in retirement. The story takes place time and time again across the country. 10,000 people are turning Medicare eligible every day. They're looking for help and they're turning to their financial professionals for that help. My hope is that this story will help you as you look to learn more about planning for healthcare in retirement. Anita, the client, has worked for almost 40 years in facilities management at a large metropolitan office complex. She oversees buildings and grounds, leads a large staff, and is managing a number of projects. As successful as she is overwhelmed by the details of retirement, especially around healthcare costs and choices. Marsha, Anita's financial professional, had always encouraged her single clients to bring along a friend or family member when it comes to discussing important retirement decisions. For the last couple of meetings, Anita decided to bring her daughter to the meetings. Anita appreciated her daughter's perspective, and her daughter liked knowing what decisions her mom was making. One of the things that Marsha had learned is that most clients don't know where to start when it comes to planning for their healthcare and retirement. When it comes to Medicare, she likes to start at the beginning by introducing her clients to the enrollment options. So as the story goes, Anita was planning on retiring at age 65. She would no longer have company-provided healthcare, so she wanted to make sure, like a lot of people, there are no gaps in her coverage. Marsha explained that Anita would be eligible to enroll during her initial enrollment period. That means she could apply for benefits in any of the 3 months immediately preceding her 65th birthday month, the month of her 65th birthday, or the 3 months after. That's your continuum, 7 months that you have during your initial enrollment period if you'd like to enroll around your 65th birthday. Because Anita was retiring in June, the month in which she would turn 65, Marsha suggested she apply in April to make sure her coverage would start on time. Because a lot of people start coverage in their birth month, for some reason they think their coverage actually starts on their birth date. Marsha made sure Anita knew that the standard for Medicare coverage is that it begins on the first day of the month of coverage. Next, Marsha addresses Medicare coverage costs. Surprised like many people to learn that Medicare costs include multiple premiums and potential deductibles and copays, Gabriella, Anita's daughter, interrupted. Even though her mom was healthy and active, she was concerned that her mom might not be able to afford the growing cost of healthcare, especially because she may live longer. Marsha calmly explained to her that if her mom stuck to their plan, she should be able to afford the healthcare costs associated with Medicare today and over her lifetime. Marsha then explained that there are generally two choices when selecting Medicare coverage. The first option is called Original Medicare. Original Medicare offers flexibility and choice. With this type of coverage, people could see any doctor or specialist across the U.S. who accepts Medicare. People who have Original Medicare also have the option to purchase supplemental, or what a lot of people know as Medigap coverage. Medigap coverage is designed to help keep out-of-pocket costs down by covering hospital and medical deductibles and copays. The other option, option 2, is called Medicare Advantage. Where option 1 offers flexibility, Advantage plans may offer more convenience. Although plans like Advantage plans may be limited to local networks of doctors and hospitals and specialists, they might also offer additional benefits like dental, vision, and hearing checkups that Original Medicare doesn't. Gabriella knew her mom liked to travel and asked her mom how that might impact which plan she'd choose. Anita knew she'd need to travel out of town to visit her sons and their families on the West Coast. And she wanted to spend time with her sister who lived in Puerto Rico. After having that discussion, all three agreed that she should consider selecting Original Medicare and purchasing a Medigap plan to pick up some of those out-of-pocket costs. That way, if she got sick or hurt while she was traveling, She could visit any doctor across the U.S. who accepts Medicare, and, as Anita was delighted to hear, including U.S. territories like Puerto Rico. Anita's next question is one that comes up a lot during our client seminars. She wanted to wait until her full retirement age to file for her Social Security benefits. Unfortunately, a very trusted friend told her she could not enroll in Medicare without also filing for her Social Security benefits. Marsha, however, confirmed that Anita could indeed enroll in Medicare independently of filing for her Social Security benefits. Marsha started sharing other helpful resources for anyone who might be seeking additional information on Medicare planning. These include things like state health insurance assistance programs, or SHIP as they're known, as well as other helpful resources like Medicare.gov and the National Council on Aging. Even though they knew they'd have more questions, Anita and her daughter both felt like they were off to a great start with their retirement planning. Anita was now ready to start planning a post-retirement trip to see her sister and have a girls' week on the beach, especially now that she wouldn't need to worry about not having health care coverage. So to wrap this story up, remember, you can enroll in Medicare at any point between the 3 months before, the month of, and the 3 months after you turn 65. Coverage doesn't start right away, so when you enroll, leave some lead time to make sure your coverage starts when you need it to. For most people, remember, Medicare is not free. There are some costs associated with coverage and care, just like you probably pay now. There are 2 different ways that most people get Medicare coverage: Medicare Advantage plans or Original Medicare with supplemental Medigap coverage. And finally, you can be covered by Medicare before you take Social Security, and vice versa.